afternoon and welcome to PVA's webinar on our response to the coronavirus. We will get started in just 1 minute. Thank you. Good afternoon and welcome to PVA's webinar on the response to the coronavirus. We thank you for taking the time to join with us this afternoon. Our presentation overview this afternoon will focus on hearing from our PVA national leaders, PVA's response, going through our various departments, medical services, veterans benefits, government relations, communications. We will then have a good amount of time to take your questions and provide answers, and then we will finish up with some next steps that you can do to help PVA continue to appropriately respond to this pandemic on behalf of our membership. Before we begin, I'd like to go through just a couple of items about the webinar process. If you have any questions during the presentation this afternoon, please click on the Q&A control box that's on your screen and post your question. All of the questions will be answered at the end of today's presentation. During the webinar, we are also going to be asking some poll questions. You will have the opportunity to participate in those polls by following the instructions that are on your screen. Finally, the webinar today is being recorded, and we will be disseminating the recording so that you will have the opportunity to go back and listen to various parts that you may have missed, and also to share it with other PVA members and members of your chapter. So it is now my pleasure to introduce PVA National President David Zurfluh, who will be providing us a welcome message today. President Zurfluh.
Thank you, Heather, and welcome everyone. I want to thank you for taking time out today during these strange times. I know COVID-19 is on many people's minds right now. We have a great set of panelists that are going to speak about that today. Carl Blake, our Executive Director, is going to introduce the panelists here shortly. But I want everybody to know that there's been a lot of information out there. We've had to disseminate a lot of information. A lot of it is confusing to folks. Hopefully we can enlighten you today, answer and entertain any questions that are pertinent to you during these times. And with that being said, I'd like to turn it over now to Carl Blake for some remarks and for him to introduce the panel. Carl, when you're ready, sir.
Thank you, David. This is Carl Blake. I'm the Executive Director of PVA at our national office in Washington, D.C. First, I'd like to thank all of you all who have joined us today. This is clearly unlike anything I think we as a country, certainly as an organization, have ever experienced. And the truth is, we're learning as we go, just like I think many of you out there are learning as you go. We're trying to understand the experiences of our members so that it can inform our response, as it's sort of a continuously moving target. We're trying to consolidate information, put as much out there, and make sure that it's tailored specifically to the needs and concerns of our members, not just veterans in general, because the truth is our members in particular are within the highest risk group, not only for exposure, but for significant consequences to come out of this. So we encourage your questions. We encourage any feedback you can provide us. I will tell you that even when this webinar is over, please reach out to me anytime. My email is carlb@pva.org. I'm a conduit for you all. So anyone that wants to reach out to me by email, please feel free to do so. You can also reach out to our Deputy Executive Director, Sean Castle, and we will do our best to respond as quickly as possible. And if you have an issue, we will do everything we can to make sure that that issue gets resolved. So again, I thank you all for joining us today. We've pulled together some of our key leaders who have been working tirelessly on our response to this situation that's frankly unprecedented. Most of our focus has turned specifically to healthcare, which you all probably know is one of the 4 fundamental tenets of the mission of the organization. We've also put a lot of effort into what we're doing on Capitol Hill, focusing on our veterans benefits, and then we also have are wrapping a lot of our communications around this. So today, the folks that will be speaking to you and giving you an update about what we're doing are the people involved in those different efforts. First today we'll have speaking will be Amanda Millicent. She's our Director of Medical Services. She can address as best as possible your questions and concerns, particularly as it relates to accessing healthcare and the broad spectrum around that. Then we're going to have Peter Gayton, who's our AED for Veterans Benefits. He can take questions specifically about benefits questions that you may have in this environment. Heather Ansley, who is our AED of Government Relations, will talk about what's going on Capitol Hill. And then Liz Deacon, who is our Director of Communications, will talk about what we're doing as a wraparound to pull this information together. And then we'll spend as much time as possible taking your questions and responding to those questions before we wrap up at the end. So again, I want to thank all of you all for joining us today. This is I think it's a little bit of a new thing for us. We've never really tried to engage this many of our members at once. And our goal is to learn from this so that we can do this more often, and not just as a response to this extreme circumstance, but to stay in more regular contact with you and engage with you so that we can learn what we need to learn to continue to evolve so that we can best serve your needs. So with that, I'm going to turn it over to Amanda Millicent, who's our Director of Medical Services, to talk about what we're working on the healthcare side. So Amanda, the floor is yours.
Thank you, Carl. Good afternoon, everyone, and thank you for joining today's webinar. What I'm going to discuss is mainly in response to a lot of questions that you all have sent to National. I encourage you all to continue sending your questions to us so that we can educate you all as best as possible with what's going on in the VA. So I'll start off with one of the trends of concerns from our membership is, has the VA implemented any guidelines for veterans who lose their caregiver support system? Unfortunately, the VA does not have solid plans in place yet for this. However, I'm hearing that the National SCI Program Office is instructing the local VAs to notify their veterans that if caregiver support is needed, what options are available to them. I think it's best if you are in this situation to contact your VA and or visit your nearest local VA if you do end up in the situation without a caregiver. The SCI Program Office is planning to upload an SCID fact sheet on the VA's website sometime this week, and this information will highlight that concern, as well as home health care, coronavirus, how it's affecting veterans with spinal cord injury and disease. So we're looking forward to seeing what that information actually says, and we will be sure to send that link out to you all whenever the VA posts that on their website. Another question that's been asked often is, how many of our members have been diagnosed with the COVID-19? I'm unsure of the number of our members that have been diagnosed with COVID-19. However, I do know that there are 17 veterans on VHA's spinal cord injury and disease registry that were diagnosed with COVID-19. And many of those veterans are being treated in the home setting, and they're doing well. This includes veterans with SCI. Some of them have paraplegia, some of them have quadriplegia, some have MS, and some have, I believe there's one that has ALS that is inpatient. This disease is very different from person to person. Many people have asked, what if I have a suppressed immune system, or what if I'm a quadriplegic? What will my outcome be? Unfortunately, this disease is so new that there hasn't been enough time for all this to materialize and for researchers to focus in on specific patient populations. There's just not enough data out there right now to provide any kind of conclusive data for the spinal cord injury and disease population, specifically to the veteran population. There's such a wide spectrum of who is getting the coronavirus. It can be from a young, healthy, able-bodied person to a person with chronic comorbidities who is elderly, who has a spinal cord injury, and that elder person that has all those comorbidities may actually come out successful in combating the coronavirus, whereas the young, able-bodied, healthy person does not. So there's so many unknowns out there of what the course of disease actually is. But I'm happy to say that many of those 17 veterans are doing well. The few that I know that are inpatient have not needed a mechanical ventilator, which is also great news. That's not saying that there are none that are on a mechanical ventilator, but I'm just unsure if any of those 17 are on a ventilator. With that being said, social distancing and infection control practices need to be taken as best as possible. Please make sure that you're washing your hands frequently, you're not touching your face. If you do need home health care services, just please make the best decision as possible if that home health care worker needs to be providing care to you or not. And if you do not want that person coming into your home for your safety, please have that conversation with your SCI care team and allow them to identify if there's any other options available to you for receiving treatment. A lot of VAs have been contacting veterans on their registry to notify them of the new policies and procedures. A few weeks ago, not all of the VAs had completed this. I hope that by now all of the SCI centers have contacted their registry. So Heather, I'd like for you to deploy the poll question on difficulty communication with the SCI center.
Thanks, Amanda. I am launching that poll now. On your screen, you will see the opportunity to vote on 3 questions, and then have the opportunity. We will show the results upon letting a few moments pass. Now ending the polling time and sharing the results. Back to you, Amanda.
I'm not able to see the results. I have my screen minimized. Could you review the results, please?
So I can repeat the results. So we had for question 1, we had of those who had experienced, have you had any difficulty communicating with the SCI center or spoke personnel? We had 17 individuals, 12% said yes, and 89 or 61% said no. And we had 41 individuals who said that was not applicable. Question 2, have you had any difficulty getting your medications? We have 10 who said yes, they have had difficulty, 7%, 124 who said no, 85% who said they've had no difficulty. And then question number 3 was any problems getting your supplies? Yes, we had 15 or 10%. The vast majority no, 109 individuals at 75%.
Thank you. That's much better news from our first member survey that highlighted that there was veterans who were unaware of the SCID centers contacting them with the new policies and procedures in place. I believe that there are some centers that are a little behind with contacting their registry, but they are all at least in the middle of contacting veterans on their registry. Those of you who reported you've had difficulty getting medications, please reach out to me at amandam@pva.org. Again, my email address is amandam@pva.org. We'd like to look into where the delays are with obtaining your medications, and also those who were experiencing difficulty getting supplies as well. Again, my email address is amandam@pva.org. And just wanted to highlight that the communication from each facility is different. Some VAs are thoroughly explaining changes to procedures and operations, and some are just relaying basic information, which is problematic when when you're talking from members from different geographic locations, because each center is operating a little differently. Some SCI centers are performing routine telephonic welfare checks, which is great. They're doing this to their most vulnerable veterans on the registry, and then some of them are making routine contact to the other veterans on the registry as well. And this is typically being done at centers that have smaller SCI registries, because they have the time and capability to contact a fewer number of people. Many centers are proactively contacting veterans to identify if veterans have any equipment needs, and if so, they are trying to order those durable medical equipment supplies and as best as possible, so that the veteran is not in a situation where he or she is needing something.
Amanda, are you still with us?
We might have lost Amanda. Maybe we just move on to Peter, and we can rejoin when Amanda reconnects.
Okay, this is Peter Gates. I'm Associate Director for Veterans Benefits Department. As we navigate this new reality, the goal for VBD is to make sure that all of our NSOs are available to any veteran who they're working with who needs access to the NSO to develop their claim, to have questions about accessibility to the facilities, questions about delayed or canceled appointments. So all of our NSOs, even though they cannot access their offices in the regional offices or the SCI units or the VA medical centers, they are still accessible to you. If you call their office, you'll get their voicemail and you can leave them a message. All of our NSOs are going through their messages several times a day and returning those phone calls. If you cannot reach the NSO that way, calls to the national headquarters are routed to our administrative assistant in VBD and also to my phone directly. So our goal is to make sure that anybody out there who needs access to their NSO for whatever reason, be it claims or questions about... Amanda, are you back?
Can you hear me?
Yes.
Yeah.
Yes.
Yeah. Do you want to finish up?
Amanda, your audio is not very good. Why don't we finish with Peter, and when Peter's finished, we'll come back to you, Amanda.
Okay.
Okay. So accessibility to the NSOs. So you should be able to reach somebody with any of your problems. Some appointments, can I still get a C&P exam even though I can't go to the doctor? And the C&P exam, you can do it through telehealth, but the NSO, just contact the NSO and they can guide you to what your specific facilities offer. Also, like
Peter, we're having some technical difficulties with your audio. So we're going to go to,
that are needed.
we're going to go
process
to the
developing
next
and adjudicating
speaker.
your VA disability claim. We worked with VA, and they're accepting electronic signatures.
Peter, we're having some difficulty with your audio. So we're going to switch now to another speaker. If you could call in using a phone, that would be best, please.
Be on a phone.
Right, I will go on and speak. So this is Heather Ansley, AED of Government Relations. We're having some windy conditions here in the DC area that are causing some technical difficulties for us. We will have our folks back on the line as soon as we can reconnect them. In the meantime, we're going to continue with our program, and then we will come back to both Amanda and Peter as soon as we can get them reconnected. For the moment, I'm going to talk to you about what we've been doing here on Capitol Hill and working with Congress in response to the coronavirus crisis that's engulfing our nation. So you've probably seen a lot on television, on social media about the legislative packages that have been passed by Congress. We're starting to number them. We've had so many. The biggest one that we had has been the COVID-3 package. And that was the full technical name of that is the Coronavirus Aid, Relief, and Economic Security Act, or the CARES Act. And this legislation was signed into law on March 27th, and it provided $2 trillion worth of relief to lots of different federal agencies, American citizens, businesses. A wide variety of individuals were able to participate. Wanted to give a quick overview of how that has been impacted with the VA and then also people with disabilities. So in that legislation, VA received nearly $20 billion to help it in response to the virus. And of that, about $14.4 billion was provided for VA medical services to address the increased demand for healthcare at VA facilities. There was also about $2.1 billion that was provided for community care to meet emergency room and urgent care demands that are related to the virus. Other provisions that were included in the legislation specifically to help veterans and help VA is telemental health services for isolated veterans, so expanding the telehealth services that are available. There is a wide effort to expand outreach to veterans in the community, doing virtual appointments, and that is an area where they have focused. There's also some modifications to the Veteran Directed Care Program that would, some of you may participate in. It modifies some of the requirements as far as temporarily waiving in-person home visits that are required in that program and to enroll in the program, and making things virtual where possible to facilitate the participation. There was also a requirement for VA to provide personal protective equipment, so that's the gloves and masks, things you've been seeing about on TV to help both VA personnel and their community-based home health workers be sure that they have the appropriate PPE, as we call it, to make sure that the workers stay safe, and also to ensure that the veterans that they are helping stay safe. We also had within the legislation a number of provisions that were important to people with disabilities and their families, including some policy changes within the bill. So there was a section allowing payment for direct support professionals to aid individuals with disabilities that are in hospital settings. An extension of the Money Follows the Person program through November 30th of this year, and a requirement that Medicare Part D plans provide up to a 90-day supply of prescription medication if that's requested by a beneficiary during an emergency period, such as the one that we're in now. Something you probably heard a lot about as part of the CARES Act is the receipt of what they're calling the recovery rebates. They have a couple of different names: economic impact payment, basically money that will be going into the pockets of Americans to help weather this crisis. And those payments are available $1,200 per individual, $2,400 for those who are married and filing jointly. The CARES Act instructs the Department of Treasury to issue these rebates based on your 2018 or 2019 income tax filing. They're going to start sending payments to most Americans in April, they're saying, and that most individuals won't need to take any action at all in order to receive these payments. That includes people who have to file taxes, if you receive Social Security retirement benefits, if you receive Social Security disability insurance or survivor's benefits, there's no action that you will need to take. The IRS is planning to mail a letter to taxpayers' last known address within 15 days of making those payments that will tell you how they made the payment to you, and also what to do in the event that you didn't receive the payment that they say you received. Now, we will note that for those individuals who receive from Social Security SSI or certain VA benefits, they're still working out how they can ensure that those individuals receive these payments because they don't have the tax filings to look at or other information. So we are working with Congress and the administration to ensure that that process will be as easy as possible. As we look into legislation coming up, we know that there are going to be multiple packages coming through the COVID, related to COVID. We're looking at what we're calling COVID-4. That's going to be another opportunity, we think, to get some issues addressed. We're looking, for one, at an increase in aid and attendance, a temporary increase to help meet increased costs that you might have from your personal care attendants and their need to have additional personal protective equipment and other expenses that may be driving that up. We're also looking at fixing the rebate issues so we don't have, if they decide to give additional payments in the future to taxpayers, to ensure that veterans won't have to file any, an income tax or any other paperwork for that. So that is something that will be on our radar screen. On the disability side, we'll be looking at a host of issues such as accessing transportation, voting. Of course, this is a very important year with the presidential election, and there's a lot of changes that are looking to be made as it relates to voting. We want to make sure that's still accessible for people with disabilities, and that we have strong protections in state and local responses to pandemics, and some of the work we've been doing around emergency management. The last thing I wanted to mention was rationing. You may have seen some concerns about rationing of scarce healthcare resources. I wanted to let you know that on March 28th, the Department of Health and Human Services issued a bulletin that's offering broad guidance on the obligations of states and healthcare providers to comply with federal disability rights laws when they're developing treatment rationing plans and then administering those in the event that there was some type of shortage that needed to be addressed. PVA signed on to guidance from disability organizations to help healthcare providers in implementing that guideline to ensure that we're not having disability discrimination in the in-treatment rationing. And that guidance is available on PVA's COVID-19 webpage and available for you to take a look at and see if you have any questions. Now, we want everyone to know that there's no indication that there's anything to be concerned about in the VA healthcare system as it relates to rationing. We had a discussion yesterday with the SDI program office. They are aware of our concerns, and we are doing everything that we can to ensure that the needs of everyone who might have this virus is able to get the help that they need. So now I'm going to go back and see. Amanda, have you been able to reconnect with us?
Let's move
Peter,
on.
have you been able to reconnect?
Let's just move on to Liz.
Okay. All right.
Hi, everybody. Happy Thursday. Is everybody able to hear me? Let me know.
Yes, Liz.
I just want to tell you that we have created a web page. It's found at pva.org/COVID-19. And on this page is where you will find the up-to-minute information about COVID-19 that's relevant to our population. How to contact your NSO. It gives you, you don't have to go searching for it. It'll come up as a PDF. There are support hotlines on there. In the Resource Center, as Heather said, we just put up how to sort of avoiding disability-based discrimination. We also have the autonomic dysreflexia card for you guys to print out. News about or information about the student loan deferment. And I saw a question about precautions with wheelchair users, and there is an article there under the Resource Center that will tell you how to take precautions with regards of transmission of COVID-19 with regards to your wheelchair. There are mental health resources. There are FAQs, so as every time we get a question like we're going to have today, it'll go to the FAQ section. And then the last thing is please follow us on social media or join our members only closed group on Facebook, because we're able to really push out information real time through those resources. So you'll have the latest and the greatest if you're following us. But nonetheless, we'll continue to add it to the COVID-19 page. With that, I think that's it.
Thanks, Liz. Have we been able to reconnect with Peter or Amanda?
This is Peter.
Hi, Peter. Can you please pick up where you left off in your presentation?
I will, but I'll be brief. My main goal is to make sure that everyone's aware that the NSOs are available to help them. We're hearing a lot of unique issues arising because of this. So if you are dealing with something that's an obstacle to your benefit process or access to VA healthcare, contact your NSO. With that, can we deploy the questions for VBD? And I am monitoring the questions that are being posted, so thank you for contributing. Heather, can I add one thing?
All right. We are launching the poll now. You should be seeing this on your screen. So we'll give everyone a minute to vote. Peter, you can speak while folks are voting.
Okay, thank you. I just want to bring up one specific issue about access to needed medical supplies like gloves and masks. We're hearing different things out in the field, but I wanted to go to our Deputy Executive Director, Sean Castle, who is very experienced in this and just recently was able to acquire what he needed. So, Sean, if you're available, can you tell us how you've been dealing with requesting medical supplies?
Absolutely. Thank you, Peter. So I know in this stressful time, I like many of you out there, have tried to figure out exactly the best way to navigate through to make sure that I have all the medical supplies I need during this time period. I'm The best way I have found is to work through My Healthy Vet. I've been a user of My Healthy Vets for at least 12 years now, if not a little bit longer. And it allows me to quickly reach out to my care providers, OT, PT, pharmacy directly, which is a great avenue to have if you're having issues connecting with people, your primary care provider, your SEI doctors, everybody through the list. If you went on my personal My Healthy Vet right now, you would see that I actually have access to all my providers in 3 different locations: Augusta, Georgia, Birmingham, Alabama, and I also have one here in the local area in DC that I can contact directly. I actually had to reach out about a week ago to request some personal care equipment, gloves, and a few other things that I use for my personal care. And when I spoke with them, I got a response within 24 hours. They were quick to tell me that they had all the supplies that I was requesting and that they would ship them out, and that they hadn't heard anywhere in the system so far of anybody not being able to gain access to gloves and other things like that during this crisis. So to anybody out there that's having issues that you do have access to My Healthy Vet, I would highly recommend you reach out through the My Healthy Vet secure messenger to reach the individual people you're trying to connect with. Again, like I said, you have everything from OT, PT, your actual SEI doctors and nurses you deal with, but probably not most importantly, but pretty close to most importantly in this scenario, the pharmacy techs. That is who I reached out to directly when I had the questions about gloves and other things. And again, it took them 24 hours to respond in less than 4 or 5 days total. Well, including the weekend, about a week, but 4 or 5 business days total for me to get all the equipment I needed to get me through this. So I would highly recommend, if you have access to My Healthy Vet, that you utilize it as a tool for you to be able to be in constant contact with your health providers during this time. Peter?
Thanks, Sean. And
Wait,
I just want to take a little bit. Go ahead,
Peter,
Heather.
I'm now going to end the polling. And because we've had some difficulty sharing the results, I will read through them real quick. So we asked folks if since March, have you had any problems connecting with your NSO? And we have 8 individuals, 6% who said that they have, 78 or 56% who said no, and 53 respondents or 38% who said it was not applicable. The second question was, have you, your caregiver, or immediate family members lost their job, income stream as a result of COVID-19 pandemic? And we have 31 individuals who unfortunately are in that position, or 22%, 91, 65% who said no, that has not happened, and 17 who said that that was not applicable. So thank you for those who voted. There is a lag time with the poll results being displayed. As I said, we're having some weather issues here in the Washington area. So thank you to those who were able to vote, but those are the questions that we addressed. Peter, please continue.
Okay, I just wanted to address a couple of questions we received directly. One is about delays in claims. Your claims are still going to be moving. Our NSOs are working with VA to better understand how we can move them quickly. So if you have a claim in the process, you do not have to start over. It will not be stopped. There may be some delays, but again, that's why I said contact your NSO, because they can walk through these problems that are arising because of this VA shutdown over the pandemic. Another question was, will there be a reduction in compensation for 100% service-disabled veterans? That is no. There will not be a reduction as of today. I haven't heard anything. There is no planned reduction in compensation for 100% service-disabled veterans. So with that said, for those who are having problems contacting their NSO, you can contact me directly by email, and I can take care of that for you. That way I'll get you the help that you need, but I'll also be aware of which NSOs may be having communication problems at their offices. So my email address is just my first name and last initial, peterg@pva.org. So I can help you with that.
Great, thank you, Peter. I understand that Amanda has now been able to rejoin us. Amanda, are you with us?
Hi, can you hear me now?
Yes, we can. Thank you.
Thank you. Apologize for that and the weather in the DC area. I just wanted to jump back to where I left off about some of the centers. The centers are giving out different communication messages to you all, which is causing some confusion if a chapter member from California is talking to somebody in Florida. The way that the facilities in California are operating may be different than the way that facilities in Florida are handling things, or their messaging is different. But hopefully some of these concerns will be addressed in the VA SCID fact sheet that should be coming out later this week. Some best practices of SCI centers are facilities that are contacting their registries. They're providing a wealth of information. Some facilities are staff members are spending 5, 10, 15 minutes on calls, just explaining the different processes and changes that are going on at the SCI centers, where some other facilities are just spending a couple minutes and they're just giving very basic information of what that particular facility is doing as far as operational changes. Some centers are proactively contacting veterans, asking them if they have any equipment needs, and if so, they are trying to address those as best as possible. And some other facilities are contacting the veterans on their registries that are most vulnerable. They're contacting them more frequently than they are to somebody who may be healthy and may not have as many needs. So as I believe Carl or Peter has mentioned, we encourage you to use My Healthy Vet. And if you're unable to get in contact with your spinal cord injury care team, you can contact your National Service Officer or one of the panelists on today's webinar so that we can help connect you to the appropriate personnel at the VA. And I encourage you to use the Facebook member page. We'll get that link out to you all. If you're not on the Facebook member page, we encourage you to join and ask healthcare related questions there. We do have one of our nurses, Rebecca Coffin, who is an administrator of the Facebook page, and she's on there daily to address any health related questions. And just wanted to talk about VA's fourth mission. Many of our members have been asking if VA is going to execute its fourth mission, will there be enough space in the facilities for me to get admitted to an SCI center? The SCI program office does not believe that this will impact the spinal cord injury system of care. There are plenty of SCID beds available, and the facilities that are planning to accept civilian veterans, if the need arises, those facilities have designated number of SCI beds in the event that they will need to admit veterans on the spinal cord injury and disease registry. And lastly, there is no approved drug treatment for the coronavirus. Some facilities are using the drug hydroxychloroquine, I can't say that correctly, to treat patients who have the coronavirus. And there are studies that are underway to determine the effectiveness of that. But at this time, no conclusions can be made to see if this is an effective treatment or not for the coronavirus. And I'll hand it back over to you, Heather.
Great. Thank you, Amanda. And appreciate everyone hanging in with us during these technical difficulties. We have received a large number of questions that we are going to begin to work our way through. So we have questions that were submitted in advance and also numerous questions submitted today. So we're just going to jump in and start working our way down that list. So my first question is going to be for, let's see, Amanda. And will you tell us a question we've had? So with the information now about the government recommending that individuals wear masks when they are outside, can you tell us if the VA is providing masks to veterans or how they can go about getting those?
Yes, unfortunately, the VA is not providing masks to veterans. They are trying to keep masks as many masks as possible for staff so that the staff are protective and taking care of patients. The VA has suggested for veterans and caregivers to secure these items at their local drugstores, online, or even to, the CDC has recommended steps on how to make a homemade cloth. So please check out the CDC coronavirus website. They have step-by-step list of how you can actually use a t-shirt and turn it into a face cloth mask. And they also have guides for using coffee filters as well. So unfortunately, like I said, there's no way that the VA is giving out masks for veterans and caregivers, but please check the CDC website. And I know that a lot of the stores are sold out of these supplies, so it may be better for you to just make your own.
Thanks, Amanda. And many of our questions are for you today, so while we have good connectivity, I'm just going to stick with you. Can you talk a little bit more about what is VA's plan for rescheduling the routine care and exams that are now being postponed because they can't be conducted virtually? And a good example is a dental cleaning. Do we know what those plans are?
The VA has identified as this as a concern for the future. Right now, they've just been focused on the huge astronomical changes that have shifted to focusing on the coronavirus, but this is on their radar. Right now, they do not have a timeline of when they will start rescheduling appointments. However, I did hear that a facility in the Northwest region has started to reschedule some appointments in June.
Thank you. Another question that we have is there any specific data about how this virus impacts people who may have MS, ALS, or individuals who have spinal cord injuries? Is there any specific information out there that you're aware of about how it may impact those individual groups?
There's no specific information out there just yet. Like I said earlier, this is all just too new, and from what I know of, the few members that are diagnosed with COVID-19, some of them are actually doing pretty well and doing well at home, and they have different various levels of injury and different diagnoses, whether it's spinal cord injury or multiple sclerosis. But people who do have spinal cord injury or diseases are more susceptible for experiencing more severe symptoms and outcomes of the coronavirus. That's not to say that every person that has a chronic condition will have severe problems with the coronavirus. It just, unfortunately, it just depends on the person, and there's no real way of determining what somebody's path will be if they are diagnosed with the coronavirus.
Great, thank you, Amanda. So can you tell us what recommendations that you might have for members about how they can do contingency planning in the event that their personal care attendant, their family caregiver becomes ill and is unable to care for them?
I try to identify backup emergency caregivers. You can contact your local fire department just to let them know that you may need, you have special needs and maybe whether you're mobile or not. We are in the middle of creating an emergency checklist in the event that a person loses his or her caregiver, and we hope to have that out sometime within the next week. That will be hopefully helpful for you all. But if you do not have a backup caregiver, or there's no emergent person available, then I would suggest contacting your VA and if needed, go to the emergency room, call 911 and go to the ER if needed.
Thanks, Amanda. Peter, I'm going to give Amanda a quick break. Are you with us, Peter?
Just reach out to me. Thank you. Yes, I'm here.
Hey, Peter. So we have a question. Is the response to the coronavirus making claims responses back from the VA significantly late?
No, there are some delays that I talked a little bit about earlier, but our NSOs are very skilled and knowledgeable about working around those new delays. Situations like canceling exams or canceling appointments, our NSOs are able to work around that. So bottom line is you may face some delays, you may experience some delays in the process, but VA has not made a blanket statement saying that claims are going to stop where they are, or when this is all over, the veteran has to start a new claim. That's not what the case is. If you have a claim that's in development, talk to your National Service Officer or NSO and work with them to expedite your claim as well as we possibly can in these confusing times.
Thanks, Peter. Can you also tell us just quickly about some of the work for those who may now be out of work? Quickly tell us about some of the work that PAVE is doing through their employment services for our members.
Sure. Paving Access to Veterans Employment is our PVA's Veterans Employment Program, and we have certified vocational rehabilitation officers nationwide who assist veterans, family members, and caregivers who are seeking employment. Now, right now, with the social distancing and everything being closed, PAVE has online a program called PAVE Connect, where you can utilize the skills of the vocational rehabilitation officers or PAVE counselors online through some training modules, but you can also work directly with the PAVE counselor, and your family members and caregivers can as well, to help if you're seeking employment for those who maybe have lost their jobs because of this pandemic. So PAVE Connect is on our website, but you can also reach out to our director of the PAVE program. Her name is Lauren Labrano, and her email address is laurenl@pva.org, or you can reach her through the website as well.
Thank you, Peter. Amanda, I'm going back to you. Can you tell us if VA is about VA's efforts to do testing around the virus, and if there are any plans for doing widespread testing, and if so, would there be options for people to get that in a drive-through manner like we've seen on TV?
I have not heard of any plans for the VA to implement those options as of now. I do know that the Long Beach VA do now have testing capabilities, and they are able to up to 1,000 people a day in that California area. The main testing site was in Palo Alto, and all the VAs had to send the labs over to Palo Alto, but now Long Beach is capable of conducting testing, and some other facilities are supposed to start performing testing as well.
Great, thanks, Amanda. And also related to getting care through a drive-through mechanism, do you know if the VA is considering doing any drive-through processing for veterans who might need routine lab work, such as that related to medications that veterans take?
That is a good idea, but at this time, they do not have plans for that. For people that need labs, there's the option to come to the clinic or to have a home health nurse come to the home and obtain the lab.
Very good. Thank you, Amanda. We have a question that relates to the antibody test and whether or not that would be available to individuals with spinal cord injuries and disorders. Do you have any information about that?
Yes, the antibody testing is not approved just yet. I think it'll take quite a while for it to be approved. So I can't say whether or not in the future if this is something that will be approved for different population groups. So right now, facilities are not using antibody testing.
Great. Next question is about prescription drugs and receiving those. Do we know if there's some type of contingency for receiving those drugs? Many people receive them through the mail as a home delivery option. Do we know if there's any concerns about the long-term ability of being able to receive prescriptions through the mail?
The VA has not identified this as an issue long-term. I've heard that many of our veterans are receiving their prescription drugs 90 days to 6 months out. If it is not a controlled substances, they have to be refilled, I believe, usually within, could be a couple weeks up to 30 days, just for safety, but they have not identified a long-term concern with this.
Thank you, Amanda. Once there is some type of vaccine, do we know if that will include individuals who may have pre-existing conditions like spinal cord injuries? Will they be able to be included in those trials?
I do not have knowledge of which specific groups will be included in those trials. I believe that it would be populations that have greater representation. I think for spinal cord injury, they probably would not be included in the initial round, just because the population for spinal cord injury is so much smaller than a population for, let's say, people that may have heart disease or hypertension or asthma.
Okay. And we have a question going back to, we talked about the contingency plan that a veteran might need to make if they lose their caregiver to the virus. And we mentioned contacting the local VA. Is there someone specifically that should be contacted? Is it the person's primary care physician, the SCID center, or the social worker?
Yes, they should contact their SCI physician or their social worker. If those people are not available, I recommend contacting the spinal cord injury hub. A hub is an SCI center that has an inpatient spinal cord unit. And if none of that works, you can always contact 911.
Thanks, Amanda. Scroll down here to another question. We had someone who was concerned. They heard that the greater Los Angeles VA medical centers were told to start rationing their masks. Have we heard anything about the protective equipment that keeps VA employees safe?
I have not heard much about this. I do know that there are some concerns for lack of PPE in the home setting and in the institutional settings like nursing homes. But from some of the SCI centers, I apologize, some of the SCI centers have expressed some concerns with experiencing shortage of PPE. And I believe that some people in a home setting are reusing their masks. But the VA does not have a current plan to receive additional masks or PPE.
And is it possible for veterans to get that PPE for their caregivers? And if so, how do they do that?
The VA would not be giving out PPE without a prescription to a veteran, and PPE would not be supplied for caregivers. Please check the CDC website on the coronavirus for how to make your own masks at home from coffee filters and cloth. I do understand that many facilities and stores are sold out of gloves and hand sanitizer. You would just try to do your best possible with washing your hands with soap and water.
And unfortunately, Amanda, we had someone whose personal care attendant was put under a home quarantine because they were exposed to someone who was known to have the virus. And it'll be 2 weeks tomorrow since that personal care attendant has been able to come and help the veteran. She doesn't have any symptoms. When is it going to be safe for her to come back and resume her duties?
The CDC website has guidelines on when people are clear from the coronavirus and they can be safe from coming in contact with other people. I believe, I can't remember if it's 2 or 3 days, but a person who has had the coronavirus, they need to be free from fever without using any fever-reducing medicines such as Tylenol for 2 or 3 days. But they should communicate this with their primary care provider and then get clearance to come in contact with other people.
Great, Amanda. And I know we touched on this earlier, but I think it bears talking about a little bit more. What are some of the specific things that our members should be concerned about with the COVID virus and how it might impact them?
That is a great question. I think that people need to be vigilant in adhering to social distancing practices and just doing frequent hand washing and disinfecting high-level touch surfaces such as your cell phone, door handles. Do everything as best as possible to avoid getting the coronavirus or coming in contact with other people if you're able to.
Thanks, Amanda. We had a question about rescheduling of annual exams. We know that those have been put on hold. Can you tell us if there's a plan about the rescheduling of annual exams later sometime this year?
There is not a plan as of yet to reschedule annual exams. There are a few centers that are trying to do some components of the annual exam virtually when they're checking in with veterans, but most of the facilities are not doing that, and they do not have a plan as of yet to reschedule the exam. But I'm sure that they will start addressing this in the near future.
When so for a veteran who might need to go to the hospital, will they provide masks to veterans when they show up if they don't have one, or what should a veteran do in that case?
There are two different triage paths. So if a veteran comes to an ER and if he or she does not display any signs or symptoms of the coronavirus, that patient will be triaged in a non-coronavirus zone. And I am not sure if VA is giving veterans who are in that zone, if they're giving them masks while they're in the hospital. Now, if the veteran is on a unit where they're suspected to have staff members or other patients that were positive for the coronavirus, those facilities have been giving masks to the patients.
Great. And while we're talking about exams, Peter, we know that there have been the compensation exams that individuals have to have when they file their claims. We know that those have been disrupted as well. Can you tell us a little bit about CMP exams and what we're seeing as far as those being rescheduled?
Yes, the CMP exams that are being canceled, VA is working to either reschedule, or if the veteran situation qualifies, VA is working with the veteran to do a qualifying exam through telehealth. Now, we're going to get some details on that. We'll get it up on the COVID website but there've been discussions over the past couple of weeks on, because we can't do face-to-face CMP exams, are some of those veterans qualified to be for a qualifying exam through telehealth, through FaceTime, or talking with the VA physician over the phone while the VA physician reviews the records and the veteran is on the line. So while there are some delays, just 1 second. While there are some delays in cancellations on exams and appointments, please work with your service officer to see what options are available to you specifically.
Thank you, Peter. Amanda, so there's a lot of concern about with the medical centers being closed as far as they're trying to move routine exams into telehealth, virtual, not allowing visitors in. Do we have any indication when it's going to be possible for individuals to go in person to the SCI clinics for routine care that they might need?
There is no timeline set right now. Like I said, they're focusing on just the evolution of the coronavirus and putting most of their efforts into that and making sure that veterans are protected. Some outpatient clinics, most of them are offering virtual appointments, whether it's telephonic or through the phone or the phone app or on the computer. But more routine appointments are being canceled and will be determined at a later date when they'll reschedule those.
Thanks, Amanda. We have a question about what happens if an individual needs to go to the hospital. And the question came up, if there was a situation where the veteran had to go to the hospital, would it be the VA or the closest civilian hospital? And we understand that NSOs are recommending that the individual go to the closest hospital and then contact the VA if they end up in a civilian hospital as that first step. So what recommendations do you have for if somebody maybe isn't close to a VA medical center, they have an emergent healthcare need, what should they do?
I suggest going to the closest hospital to that person. You never want to wait on getting to a facility if you're in an emergent medical situation. We have posted the autonomic dysreflexia card on our PVA COVID-19 website, and that is for you all to be able to print, and please keep it handy. And in the event that you do go to a hospital that has staff that are unfamiliar with spinal cord injury and autonomic dysreflexia, that would be a good guide for those staff members to review and identify that this is a problem for many of our members.
Thanks, Amanda. We've gotten some comments with concerns about whether or not people can get prescriptions for gloves. So we had the VA at the Palo Alto SCI Center has informed the chapter there that pharmacy is no longer giving gloves to veterans who have a prescription. Of course, this is very concerning to us due to the lack of safety in conducting that care, and there's concern about whether or not that might be happening in other places. And then we also understand someone else mentioned that they had asked the VA pharmacy for a face mask using My Healthy Vet and said they would not supply them. So I think we've covered the face mask. We understand they're not doing that, but is that the case even for if you need it for a care provider? So if you have a prescription for gloves, have we seen those not being honored in other places? And what about any face masks that might be needed for your care provider?
I have not heard of this happening anywhere with the glove situation, so we will contact the SCI program office and Palo Alto just to confirm and see what their plans are. As far as the face mask, they are not unfortunately, they're not giving out face masks for caregivers. So caregivers will just have to do as best they can with creating their own cloth face masks to provide care.
Thanks, Amanda. A question that relates a bit to medical rationing. If you could answer this from the VA side, and then I can fill in with the broader disability civil rights side. But we have a question about how would an ALS patient avoid getting triaged out of getting a ventilator should there be a demand for those ventilators at a hospital. So basically, if we're in a situation where we have we have more demand than resources available, what would you recommend that veterans do at the VA?
Well, there are federal guidelines that are in place to avoid these scenarios. So physicians and practitioners, they should not be making those decisions on their own of who is able to receive a ventilator. It should not be determined based on that person's abilities. And it really should be a, first come, first serve situation. And then if there is an unmet demand, then I would assume that they would have to potentially contact local facilities and transfer those people out so that they can receive ventilator support. And I will let you talk more about the disability rights, Heather.
Thanks, Amanda. We did have this discussion yesterday with the SCI program office at VA Central Office. PVA and the broader disability civil rights community have been looking at concerns related to rationing and some of the state plans that are out there. I would say, again, the March 28th bulletin that was issued by the Department of Health and Human Services, that applies to both civilian hospitals and also to VA as far as making sure that if such decisions are needed in the event that there is a shortage of equipment or beds, or with regard to healthcare personnel, that there wouldn't be discrimination against people with disabilities simply because they have disabilities. The guidance, along with some explanation material that we think healthcare providers should use in making those decisions, has now been posted on VA's COVID-19 website. So you can print off that information, you can have it with you. We have also agreed that we will provide that information directly to the SCI program office so that they can be aware of our concerns. I will reiterate that as of now, we don't have any indication that this is something to be concerned about in the VA, but certainly it has been a topic of discussion. I can say, I believe it was the state of Alabama had in their state plan some information about how they would make decisions in allocating scarce resources. There was a complaint filed with the Department of Health and Human Services, and yesterday the department spoke and said that the state plan did not protect people with disabilities, and so that is a good sign that people are seeing that there will be efforts to ensure that people with disabilities are not discriminated against in getting that type of care. Another question that we had, Amanda, is so we've talked about people maybe having some problems right now getting that personal protective equipment, such as gloves, from the VA. Are we foreseeing that there's going to be some type of ongoing shortage in the future just because of the increased demand for those types of services?
I believe so. I've heard stories that some of these facilities that are making these supplies are having some difficulty with their equipment being able to keep up with the demand. So I know that there's several different organizations volunteering some of their their PPE to hospital personnel. But I think that this is a major concern for the future.
And we do have concerns, Amanda, from some folks that they won't be receiving their regular shipments. So maybe you could talk to us again about what should a veteran do if they don't receive the gloves or other equipment that they typically do receive that helps them with their home care. What should those veterans do?
That's a great question, and it's a hard question to answer if the VA is running out of supplies to give to veterans, and if drugstores and stores do not have PPE. I would just suggest just frequent hand washing. I think it'd be very difficult to not have gloves to perform bowel and bladder care. Maybe potentially using plastic bags over your hands, and obviously just throwing those away once that person is done using it, and be sure to thoroughly wash your hands with soap and water after that for at least 20 seconds.
And Amanda, if we have individuals who have a need that the gloves are not available, they're using those gloves to do things like performing self-bowel care. Obviously, gloves are a priority to them. What should they do in the event of an emergency?
They should contact their service officer or their VA, but I would imagine it would still take a few days for them to receive shipments of PPE. If their stores are out of those, I think that the only alternative really is to use some sort of maybe plastic bags around their hands.
Thanks, Amanda. We've also had, I know there's been a lot of concerns about whether or not VA facilities are being used to house non-veterans who may have COVID, how those resources are being allocated. And we have a concern about, in Seattle, some SCI patients that are being admitted into other units at that facility, even though there are open beds in the SCI unit. Can you talk to us about that?
Sure. There are some facilities that are, if not all, admitting that on the SCID registry to other areas of the hospital, and this is more so to protect veterans that are already on the spinal cord injury unit. So they're typically admitting these people to non-SCI units for a couple of weeks, and just to make sure that they don't have the coronavirus. And if you sort of, I would say that they are quarantining them in those zones, and then after about 2 weeks, they will admit them to the SCI unit.
Great, thank you, Amanda. We have a lot of concerns about, like I said, getting the personal protective equipment, masks. I know you've suggested people go to the CDC website to find information about how to improvise if needed. We have some more concerns about whether or not for people who are on ventilators, is the medical center, if you're already using a ventilator as part of your everyday care, Amanda, within the VA system, can that ventilator be confiscated and given to another veteran or someone else who might need it?
No, it should not, under any circumstance, be confiscated. The only time that a veteran should be removed from a patient is if it's that under that patient's living will, or if it's the family's wishes, and then they would be able to use it for another person.
Great, Amanda. We also had a question about for individuals who might have do not resuscitate orders. Do you know if they needed a ventilator because of a COVID-related response? Would they be able to get that? How does a do not resuscitate work with that type of care that might be needed?
It depends on what the person has selected in their living will. There are a few different areas on a living will that address if the person wants mechanical ventilation, if the person does or does not want mechanical ventilation, does or does not want CPR, does or does not want feeding tube, et cetera, et cetera. So if the person checks that they do not want mechanical ventilation, then the care team will not put that person on a ventilator. However, if they check that they want it, then they would have to put that person on mechanical ventilation if needed.
Thanks, Amanda. We've had a lot of questions here today that I know we have, and we have information that we are putting on the PVA COVID-19 webpage on a regular basis. And Liz, if you're still with us, I know you briefly discussed some of the information on the website, but based on some of the questions we're getting, I'm just hoping you might be able to talk us through some of the items on the website, and maybe you could just give us a preview about some of the items that you're planning to add in the near future.
Sure. So essentially, as things come in from the VA and the things we're creating ourselves, it'll go up automatically. So, for example, I just received something from the VA about caregiver support and needs. And that document will go up on the COVID-19 page under resources. We are creating a checklist as well as what I'll call a decision tree for our members, sort of like, what do I do if I think I have the COVID-19, and we'll tell you what to do. And for whatever reason that doesn't work or you should do something else, we'll tell you where to go next. So it's really easy for you guys where you don't have to remember absolutely everything that you need to do. Whether it's call your SCID center, whether it's to call an NSO, whether it's to go to the local hospital, we'll have sort of a decision matrix on that. And we'll also adding information on developing a plan, an emergency plan. If you don't get your health care, if your in-home health care goes away, what are some of the things you should think through? So Heather, I'm not sure if that answered the questions or not.
It did, Liz. Thank you. I wanted folks to just know that is where, when every time we see something coming through that we think would be helpful, whether it's how to stay safe, using your wheelchair out in the community, yes, getting the needs of your caregivers met, that is a place where we are sending individuals to be able to get the information that they need. And of course, being able to work with your national service officer, your NSO, that was discussed today. Any concerns you have that come up, please do reach out to them. And they feed all of those up here to the national level so that we can get the answers that are needed as we move forward. That's
also going out. Sorry, Heather. It's also going out through our social media channels and within the closed member group on Facebook. So there's a lot of Q&A going on there as well. So I just encourage everybody to try to join that group.
Great. And Liz, how do members join the member only Facebook page? What do they do if they want to reach out and get that information?
It is actually, I will put that at the top of the COVID-19 page. It can also be found in our membership section on the PVA.org website. But there is a URL, and it's escaping me right now. But we'll get it up on the website right away.
Thanks, Liz. So we've we've answered a lot of the questions that we received today. We have a couple that Carl is going to address in his final wrap up about next steps. If you have questions that come up that you didn't have a chance to ask today, or you feel like you need further clarification, please feel free to reach out to us, anyone who's on the call, your service officer, and we will do our best to assist you. So I know one of the things, I think we can tie these together, Carl, is we don't know how long this is going to be going on, where individuals may need to be in their homes and socially distanced from their neighbors, their fellow veterans. So as we look at what will be happening in the future, that includes things like access to rec therapy. Unfortunately, we know the National Veteran Wheelchair Games had to be canceled for this year. But maybe you could tell us exactly, some ideas we have for what we're looking at in the future, and what type of recreational activities might be available, in lieu of some of the opportunities to get together.
Yep. Okay. Thanks, Heather. So obviously this is uncharted territory for us. Frankly, I don't think we know what the future really holds. I think there are probably a lot of people here who are participants in the National Veterans Wheelchair Games. I would tell you the games will be back. We will be in New York next year. So I would encourage you to look forward to that. There was a question about recreation therapy. The unfortunate situation is VA has kind of shut down its access to a lot of these things in order to protect itself and the veterans it's serving currently. It doesn't mean you can't get out if you're capable. Here where I'm at today, it's a beautiful day. Sometimes you have to make time to just get outside. We do have some concerns about what this might mean for people's mental health. I think everybody, whether you're a PVA member or just an individual citizen sitting at home, this is going to be a trying time for everybody. But if you have any issues, if you ever run into any issue, or you have some concerns, or you just want to talk to somebody, reach out to any one of us. Reach out to one of our service officers. I would give out my cell phone, but that's a dangerous game. But if you shoot me an email, I'll be glad to reach out to you directly. That's what we're here for. The same for Sean, same for our leadership team here. We're a conduit for you. If you have any concerns, please don't hesitate to reach out to us. We don't really know what this might mean for PVA in the future, but I can promise you this much. PVA will be around when this is over with, and we will continue to do everything we can to serve our members in the best way. Next steps for us, look for more of these types of opportunities. I think we want to continue our engagement with our members, more webinars, more opportunities to connect. Always feel free to shoot questions to us. We'll do our best to answer them as quickly as possible. There's a lot of information on our website. You should be able to see it on your screen. Our PVA COVID website is pva.org/COVID-19. That is our clearinghouse for every bit of information. We also just published a survey for all of our members. Please go and check that out at that link. And again, if you need to reach one of us, connect with one of our service officers. They're on the front line. Don't be afraid to connect with them. So I want to thank everybody for participating today. I want to thank our staff for spending the afternoon with our members. This is important to us. It should hopefully important to you, and we're going to continue to do more of this. And if there's nothing else, everyone enjoy the rest of your day. Hang in there. We're going to get through this, and we'll talk to everybody soon. Thank you.
Thank you. This concludes today's webinar.